Well, joining us for more on this special day is Dr. Jafia Abubakar, Deputy Director and Head Epidemiology Division with the Nigeria Center for Disease Control. He joins us virtually from Abuja. Thank you for joining us on the program.
Thank you, Millicent. I'm happy to be here.
Now, the past year has brought more visibility to the work of field epidemiologists as the world continues to battle the pandemic. How has this field, epidemiology, how has it shaped the coronavirus pandemic, especially in Nigeria?
Yeah, so essentially epidemiology, is there to support the fight against any disease. It is the study of how disease spread and why they spread. And for COVID-19, we have supported the response in many areas. As you are aware, it is very important that we detect cases of COVID early. So field epidemiology has helped us to do that. It has helped us to identify and monitor the contacts of these cases so that we can also bring them early to care if there happen to be cases. Field epidemiology ensures that we regularly analyze our data to provide us with scientific information that will guide our decisions and policies. It has also made available skilled human resources to support our response efforts. Field epidemiologists also support in diagnostic capacity, including the use of RDTs. They have supported in points of entry surveillance, and even the public health and social measures that we have in place. This was informed based on the contributions and scientific evidence that has been provided by field epidemiology. So these are a few amongst so many things field epidemiology has done to support COVID-19 response within Nigeria and globally.
Dr. Abubakar, I mean, what has the experience been from the Ebola outbreak in 2014 to the impact of COVID? I mean, and this is despite the current healthcare system some have described as weak. Are we where we need to be?
Yeah, we are not where we need to be, really. However, it is important to say that we have made tremendous, progress. I will take you back in 2017. Nigeria conducted her first joint external evaluation to assess her preparedness in terms of, detection, prevention, detection, and response. At that time, Nigeria scored 39%. However, 2 years later, in 2019, Nigeria again conducted a midterm joint external evaluation. And we moved up to 7 places, up to 46%. It's not easy. It's a gradual thing. And I'm also happy to inform you that as we are talking now, Nigeria, through the National Center for Disease Control, have deployed digital surveillance tools across all the 774 LGAs in Nigeria. We have also established public health emergency operation centers, which serve as coordination hubs, which serve as centers where preparedness and response efforts to outbreaks, are done. Across all the 36 states and FCT, we have those, public health emergency operation centers. Also, currently we have over 110 PCR laboratories spread across all the 36 states and the FCT. So these are some of the achievements that we have done, through the period, starting right from the Ebola outbreak to where we are today during the COVID response. We are not yet where we are. There are still some challenges. I mean, investments and funding in global health security, can be improved. Human resource capacity gaps can also be addressed. We need to pre-position medicines, supplies, and additional, vaccines. All those areas, requires, additional investments.
So hopefully epidemiology will help us understand our options going forward. Finally, in a few seconds, if you can, how do you expect Nigeria can build back better? And this is from the COVID-19 response to strengthen our capacity also to preventing, detecting, and responding to future outbreaks.
Yeah, today being the World Field Epidemiology Day, I will advocate to all our levels, all the levels of government, to increase investment in health, to ensure that currently we have only just about a ratio of one advanced field epidemiology graduate to about 600,000 Nigerians, whereas the global standard is to have 1 to 200 people. So I think we need to increase investment across all these spheres so that we are better prepared as far as global health security is concerned.
We appreciate your time on the program. Many thanks for joining us. Dr. Jafi Abubakar is the Deputy Director, Head Epidemiology Division with the NCDC. Thanks again.
Thank you for having me.